So what went wrong is an incorrect diagnosis from an incorrect diagnostic test that resulted in a medication error. A fishbone diagram shows that the employee, people around the employee, the environment, and equipment are all part of the problem. For the employee, obviously the nurse was careless in identifying the patients and in resetting the machine. She did not follow protocol with identifying the patient with the two name and date of birth identifiers that this facility required, and she failed to communicate with the patient his and her, or her name. The environment may have been of high stress and high stakes. Obviously, this is the emergency room, and that's the case. And also the culture of haste in the emergency room, which is almost inevitable, could have contributed to the issue. Next, we have people, a lack of communication between the EKG reading nurse and the doctor, um, and the nurse being unwilling to ask the doctor if the patient really needed the diltiazem, because obviously patient A and patient B presented with similar symptoms, but the symptoms may have been worse for patient B than they were for patient A if they had uncontrolled and the other one controlled atrial fibrillation. An absence of support could have contributed as well under the people category, because nurses that are afraid to ask questions are typically nurses that lack support. And a scornful relationship between doctors and nurses could have also contributed, because if nurses and doctors collaborated completely and well, then there would not be any hesitation in asking questions and in being sure of things. So if there was less scorn in the relationship and more positivity, maybe this mistake could have been avoided. And lastly, for equipment, for the EKG machine, a failure to reset should be the main issue. Obviously, the machine can't reset itself and know that every EKG is for a particular patient. Um, Therefore, a lack of safeguards in the machine's computer could have been the issue. All of this resulting in incorrect diagnostic and incorrect medication administration.